Members, we've got the quorum. Let's start the meeting. Agenda item 1, confirmation of minutes. Earlier, we sent a draft minutes CB bracket 1AA/1415, and that were the minutes of the meeting on the 9th of October. So the clerk has not received any proposal for amendment. So no objection. Let's confirm the minutes. Item 2, information paper issued since the last meeting. No information paper issued. Items for discussion for the next meeting. That will be on the 8th of December, 10:45 a.m. The government has proposed 4 items to be discussed. First is setting up a new contract residential care home for the elderly with a daycare unit at welfare block of Sha Mun Estate Phase 2 Public Rental Housing Development, Sha Tin. Second, setting up of an integrated rehabilitation services complex at the site of ex-Kai Nang Shuttered Workshop and Hostel, Kwun Tong. Third item, setting up of an integrated rehabilitation services complex at the site of the ex-Siu Lam Hospital, Tuen Mun. Fourth, elderly services program plan. For the first 3 items, they are new services, and they are here to seek our views. And the 4th item, that is, there is a working group under the Elderly Commission which is mapping out a 2-year plan for elderly services. So among the 4 items, for the first 3, they are relatively simpler, and the crux of the day may be the 4th item. Any views on these 4 proposed items? If not, then we will adopt those items for discussion. And then let's move to the 4th item, is pilot scheme on community care service voucher for the elderly. The government officials attending today are Mrs. Elena Chen, PAS for Labour and Welfare, and Ms. Cecilia Lee, AD of Social Welfare Elderly. Welcome the 2 officials. Well, please get seated first. Mr. Chen, would you be taking us through the plan or the pilot, and then we'll follow up. Thank you, Chairman. Good morning, members. Good morning, Chairman. Today we are here to talk about the pilot scheme on CCS voucher. And we've attended the meeting before, and we are all very clear aging in place is the underlying principle of the government's elderly care policy, and it is also the aspiration of the elders. And every year we will commit more resources to subsidized CCS. So we hope that the services can be provided in a more diversified and flexible manner. And in September 2013, we launched the first phase of the pilot scheme. And we have adopted the monofollow users principle, and we provide direct subsidy to eligible elders, and they can choose the type of service and the mix of services. The first phase has the following key features. Well, and actually it has been aligned in paragraph 6 of our paper. And in January this year, we also came to the panel to brief members on the scheme. Up to October this year, a total of 1,000 elderly persons had participated in the scheme, and 1,230 are being current voucher holders, and 842 were receiving services, and the rest voucher holders are still trying to choose their desired service provider and or service package. The relevant statistics are outlined in our annex to the paper, so members can take a look if you like. For the scheme, up to now, we have some initial observations about the usage pattern and the reasons for withdrawal from the scheme. Perhaps I'll now defer to Ms. Lee as Director to take us through those points. Thank you, Chairman. Let me talk about the elderly persons participating in the scheme. There are two models. One is the part-time daycare service, and then the other one is daycare, part-time, and home care service. Among the 800 elders, over 600 of them opt for the single mode part-time daycare service, and 234 opt for the mixed mode. For the daycare service, they are receiving on average 5 to 6 sessions, and for mixed mode users, they receive on average 4 sessions of center-based daycare a week, as well as home-based rehabilitation, exercise, personal care, and nursing care. The most common services used are for example, cognitive training and physical training. And for nursing care, they include wound treatment and also dispatching of medicine and so on, or taking medicine at home. And for personal care, they may need home cleansing service and so on. There are some 50 service providers which have commenced operation in September, and for several of them, they commenced operation in December last year. So actually, some of the elders have been enjoying services for only a few months. So our overall concern is about the co-payment situation. And in January, we reported on the same, but then there has been a change. Around 72% of the elders are paying Category 1 copayment, $500. And for Category 5 elders, there has been an increase of from 6% to 8%. These are categories based on the income of the elders. Now, in fact, 500 elders have once joined the program but later withdrawn. The main reasons for their withdrawal are that they are about to be offered the subsidized services on their waiting list, and for 21% or 40 elders who have participated in the pilot scheme but then are later offered the subsidized services. So elders can choose to wait for the subsidized services while they are on the scheme. So this is basically the overall situation of the elders.
Now I'll open the floor for members to ask questions. There are so far 3 who have indicated to speak. Let me read out their names. Tam Yu Chung, Leung Chi Chiang, Poon Siu Ping, and Fernando Zhang. Albert Ho. Chen Yun Han. About 4 minutes each. Mr. Tam. When I look at the annex, I see that when it comes to the reason for withdrawal, just now, the AD said that there are 575 elderly people who have withdrawn, and no suitable service provider service packages, 184. So I'd like to know that out of this number, have you done anything to find out more about the actual reason And some service providers have said that because of the shortage in resources and shortage in manpower, they are not able to provide services. Are there any other reasons? Have you done any studies? Any information to supply on top of that? Is the main reason shortage of caretakers or healthcare workers? Well, when it comes to no suitable service providers or service packages, that is a general comment. We have asked the Hong Kong U, their accounting team, to conduct an in-depth study. They may visit elderly people who have left the scheme and ask them the actual reason for the withdrawal. At the early stage, some service providers said that in preparation to join the scheme, they had to recruit healthcare workers. And after that, we know that a lot of the service providers are actually ready. There is not the reason that they cannot provide a service because of shortage of manpower. When it comes to selection of districts, say for example Sham Shui Po, we hope the service providers will provide service to Kowloon City and Yau Chim Mong. But because some of them are from different districts, they are concerned about a proper transportation service. So they hope that the service providers will be near where they live. Given the information, we know that they would like to arrange service providers that are close to them so that suitable services can be provided. Well, if you're talking about money follows the users, well, it means that the elderly people will have a lot of choices because there are a lot of service providers. But is it the actual case that there are actually a limited number of service providers and hence a limited choice for elderly people? Is there room for improvement? Because if there aren't many choices, then if they don't choose what's on the list, then they don't get anything. So they simply withdraw from the scheme. We keep in mind that there should be more than one service provider, because if there is only one, there is no choice. We see that for some districts there are quite a number of service providers. There is one district where there is a minimum number of service providers of 4. For Kwun Tong, there are over a dozen. But I think that we should pay more attention to service packages. What we heard from the elderly people is that, well, we have the mixed mode, we have the single mode for daycare and home care service and daycare service. Some of them think that they only want a home care service and not daycare and home care. So we are considering whether we can inject more flexibility into the scheme. Mr. Leung Chi-Chang. And this may be a pilot scheme, but the idea is to give more choices for the elderly people so that they can choose suitable services. Now, the idea itself is good. I see from the figures that the voucher scheme is well received. Say, for example, in paragraph 8, it says that 1,800 elderly people participated and 1,233 are currently using the vouchers. 842 of them were receiving services from the recognized service providers, so the figures are quite high. When it comes to elderly people, you have to provide them abundant information so that they can make an informed choice to get the best service. But I've heard from some people that the service sometimes leaves room for improvement. Say, for example, the person actually providing the service at their home, and they would like to maybe change to a different person, and that's something that they cannot do. Well, I know that these vouchers are available for those who are classified as moderately impaired under the Standard Care Need Assessment Mechanism. Say, for example, in Tuen Mun, how many service providers are there? If I don't choose Tuen Mun, if I'd like to choose, say, Yuen Long, are there enough choices? I think that is very important for them. My second point. After they have successfully got their application for vouchers approved, how much time do they have to find a service provider that they would like to use? Let me first answer the first question. But then the second question, in principle, after they have obtained the vouchers, they can use 3 months to choose a service provider. That is only on a pilot basis, and we would like to be flexible. Currently, there are over 800 who are participating, and there are also 100 or so who've got the vouchers and have yet to choose. 77% of them have got the vouchers but have not decided about the service providers or service package. But it's not the case that if you don't make a choice within 3 months, we are going to take away your vouchers. Well, say in Kwun Tong, if you are eligible for the vouchers, in principle, apart from choosing service providers in Kwun Tong, you are allowed to choose service providers in other districts. But if it's another district, then we have transportation to consider. And once you've chosen one service provider, can you change? Yes, you can. But in previous schemes, that might be difficult and you're not encouraged to change. But now you are given the choice to choose, to change if you so wish. But we understand that there needs to be some kind of stability. And if they've used it for, say, a month or so, and you find the service unacceptable, or if you find a better service provider, then yes, you can change. Family members or the elderly person can take the vouchers back and switch to a different provider. We do understand that there needs to be a lot of information made available to elderly people or their families. And the elderly people need to talk to their family. But the mindset is different, because in the past, once you're assigned a center, you will have to go to that particular center whether you like the service or not. But now, we would like the elderly people and their families to constantly review what they need and look for service providers that can best suit that need. Next, Mr. Poon Siu Ping. About the way forward, you said that the administration will work together with the South Pole Center on Aging of the Hong Kong U to conduct an evaluation study. And the administration will explore the need for second phase and maybe introduce refinement. Can you give me details about the second phase? That's my first point. And you mentioned about the reasons for withdrawal. 184 of them find that there is actually no suitable service providers or service packages. I would like to know, out of this figure, well, once they have withdrawn and later if they find a suitable provider, can they join the scheme again? I will answer the second part of your question. If a withdrawal is made, and if later they would like to use the service again, they can talk to the responsible worker to rejoin. Well, say if it is under the single mode, say a daycare service, we require the service provider to provide between 5 and no more than 7 sessions a week. Some elderly people may think that itself is a restriction. And under the mixed mode, we require the service providers to provide 2 to 5 sessions, no more than 5 sessions for daycare, and no more than 8 hours for home care service. Some elderly people would like to have more of this and less of that. So, in effect, there is a framework in place. We can draw the experience to refine the arrangement for the second phase. Mr. Poon asked about the evaluation study done with South Pole Center on Aging. They have conducted certain studies by looking at the welfare services department's figures, questionnaires from users and their family members. Interviews with elderly people who have withdrawn or do not participate. Detailed questions will be asked. Information will be obtained about the family background of the users. Perhaps it's because of the family members or the reasons related to the family that they do not make a certain choice. After we've collated the information, we will work on a second phase. We hope that there will be more flexibility in the second phase, because when it comes to service vouchers, we want to give more choices for the elderly people and their families. So there should be more flexibility when it comes to choices and more flexibility for service provision. And currently there is a framework for the service providers. And at the early stage, service providers ask a lot of questions about whether whether what they're doing or propose to do is in line with the framework. It takes time to find the right way. But what we have in mind is flexibility. They have to be within the framework while giving flexibility to elderly people and their family members.
We want to provide personalized service catering to the specific needs of the individuals. So this is our objective, and we hope to achieve that in second phase. Dr. Fernando Zhang. Thank you, Chairman. I think the number of places is too small, 1,200 only. Those who are waiting for subsidized RCHE, well, number over 30,000 people. 20,000 people are eligible for residential care services. Now we have a figure of only 1,200, and the scheme started in September last year. And if the need was so big, then the places would already have been filled in the first instance, but then only 17% of the places have joined the scheme only in the past 3 months. They're still thinking about it. So, according to Ms. Lee, so you can see from the response that the design of the scheme is not very welcomed by the elderly people. It doesn't meet with their needs. I think the biggest problem is you are going to resorting to market principles. Now, for the home care service and daycare service, there are queues of people waiting for months or years to get the service. So the service is already inadequate. But then the government is not trying to increase the number of places for these services, but rather asking the lotteries fund to sponsor this money follows the user principle pilot scheme. And you need means tests and so on. I think you are going along the wrong direction. Those who are on the waiting list, they would not be incentivized to join because they may not have the money for the co-payment. And for the more affluent elders who may be supported by the family members, they are more willing to join. Well, there are a number of loopholes to this scheme. So in your study, I hope that you can study certain issues. Number one, co-payment is a problem to many families. So can you study into elders with financial difficulties who want to join but can't join? Can you look into that? Second, the scheme is very much constrained by the kind of services provided by the service providers. And these services may not meet with the needs of the service users. So that's why people are not very willing to join the scheme. Also, the case managers are sort of staff members of the service providers, but then I suggest that the case managers should be somebody independent. They are there to make all sorts of arrangements. So if they are employees of the or connected to the service providers, there is a conflict of interest. So on that point, can you consider whether case manager should be independent people? Because a case manager linking to the service provider may take care of the interest of the service provider only and not the service user. So if you do not consider these points, then that's no good. Now, also the overall demand, you have to look into that as well. We don't have enough RCS, CCS. Should we be just using these the CCS voucher scheme? I don't think you should be taking a one-sided approach, and you provide a small number of places for the elderly persons to purchase their own service, and the needs of the vast majority of the elderly persons in need are not being met. I think the government has listened to your views already. Mr. Albert Ho? Chairman, when the scheme was first launched, there were criticisms from members in that the scheme was too small in scale and the pace was too slow. If you try to reduce the pressure on subsidized RCS, then that's no good, and we are not happy about it. And now the scheme has been implemented for some time, and we are seeing that when elders, it's their turn to get subsidized service, and they will withdraw immediately from this scheme. So you can see that the elders are very keen to receive subsidized service for various reasons. So it means that the voucher services are not adequate. They need subsidized, full-scale subsidized services. We need to find out the reasons behind this. You are now waiting for the results of a study by Hong Kong U, but then since you have case managers, are they doing any kind of questionnaire survey? Now, for example, in the case of legal aid services, they are constantly conducting surveys on customer satisfaction. And so that we know what the problems are. I think you should be now collecting information instead of waiting for Hong Kong U to do it. People will not be willing to talk to you after they have left the service. Now, even if the case managers have conflict of interest, so to speak, then they must have some basic information to tell us the picture. So people, the elders are withdrawing from the scheme once it's their turn for subsidized services. So how does it do to the situation? I think this study is very important. You must increase the scale of the pilot scheme. So why don't you ask the case managers to collect or conduct a survey on customer survey now? That's not going to be complicated. And you can ask them why they don't want the service. I think that would help very much in the study to be undertaken by HK Hong Kong U. Are you collecting information now from the elders? Well, I think we have to respect the wishes of the elderly persons to withdraw from the scheme. If they have withdrawn from the scheme, then they are put into the non-active case files. And for some of the elders, they are put on the deactivated case files. And the voucher scheme is not there to replace the residential care service. Indeed, the elders have demand on that. But if you are waiting for RCS and you can still get some community care services in the interim, then that would do you all kinds of good. In terms of your physical condition, it will get improved. And for some of the elderly people, they will still be on the deactivated case files. And if the situation changes, they want to get subsidized care services as well, then we can activate their files once again. Now, will it be the case that the elders who are poor will not join the scheme? But if you look at the statistics, 72% of the elders are paying the minimum amount, $500. So I would like to tell members that the present community care services are not provided free of charge. Daycare services, $900 minimum, and for some, $988. The fee will depend on the kinds of services they receive, and on average, the elderly pays $300 for community daycare service. So 72% of the elders in the scheme are paying just only $500. So it's not the case that they could not afford it and they didn't join the scheme. But I agree that this is a pilot scheme. And the more information that we give to the elders, the community, the elderly center, and the case managers, the more we will know whether the service is useful. She hasn't answered your question. Well, can you ask the case managers to do some simple questionnaire survey? Well, why can't you do that? Because the case managers are already handling the cases anyway. So I think the administration has heard your views, Mr. Chen Yunhan. We've been talking about this money follows user principle a long time. I think this is an acceptable principle. But then the question is, there are so many people waiting for the services, and you have a quota of 1,200, and you are asking them to pay part of the money. And Ms. Lee said that 72% are willing to pay $500. I hope that the administration can adopt a different perspective. Some elders have been waiting for services for a long time, and they've been saving up for that the service. It's not that they can afford it at all. No, that's not the case. And the question is, the problem is you don't have enough places. So in that case, how would you try to respond to demands from this electrical assistant director? Please think about this. I think you are taking the issues too lightly. There are so many people waiting for services, and the number of places of the scheme is too small. And the electrical members will be chasing after you on this point. You haven't really answered Dr. Fernando Jones' question. In our regular subsidized community daycare services, we've been increasing the number of places. We will increase the number of places of daycare services, say 220 places. 220 places will be added. Let me try to speak from another perspective. I have just reported that 608 elderly people are opting for the single mode for part-time daycare service. So this means that under the pilot schemes, some 600 elderly persons are offered part-time daycare service. I think it's one way to ease the pressure of elders waiting for residential care services. The question is whether we are providing the right services, we are offering enough flexibility. These are the points that we will consider in the next phase. Now, as I said, some 600 more elderly persons are receiving daycare service. Perhaps 1 to 2 months later, it's their turn to receive subsidized CCS. Then they may go to that other service as well. But then there are still new elders who would like to join the scheme. I think this is new resources, and this is because it's a pilot scheme. We are drawing funds from the lotteries fund to subsidize it. Chairman, I said I don't object. Money follows the user principle. It's an additional avenue to deal with the problem. But I don't agree to the first part of your answer. I must clarify that point. Now, if the administration thinks that if you adopt this voucher scheme, then you'll be able to resolve the problem of waiting lists of some 20,000 to 30,000 elders. Now, I've been thinking about Dill's Corner, RCHE, and it's going to be demolished. And what will you do to help them? Now, I don't object to this principle, and I would like the Hong Kong U to study into the matter. When we don't have enough services, I think we must proceed with the pilot scheme, and you still have to resolve some problems within the scheme.
But you have to do something more as well. Say, for example, for clearance. Well, you have to put in place supporting facilities. Because as you provide more service, there will be more people joining the queue. So you have to think about that as well. I think she was going to answer. Maybe we'll find time to answer Ms. Chan's question, because there are still 4 to 5 members who would like to speak. We have a very tight schedule. Mr. Lang Yu-chung. The purpose of the scheme is to actually test the operation of money follows the user. When you select certain districts, you did not choose Kwai Ting. I think Kwai Ting is an aging district. It puzzles me that you did not choose it. When if you say that there are limited resources, then you should identify districts with special characteristics. Well, I would think that an aging district would be as a district with special characteristics. You said that 1,808 elderly people joined as at October 2014, and 1,233 are current voucher holders. 1,233 of them. Out of these 1,233, 842 were receiving services, and the 391 of them were choosing their desired service provider. You have used 1,800 elderly people as in a pilot scheme, and now we see a division. On one side you have 800 or so, and on the other about 400. Does it serve to actually test the effectiveness of the scheme? The number of people participating will have an implication on the effectiveness of the test itself. Do you think the number of people participating is sufficient in this regard? We catered for 1,200 of them to be using the vouchers, and currently there are still several hundred of them who have got the vouchers but have yet to choose the provider or the package. As I've said, that some of them have just obtained the vouchers and they're still making the choices. In a few months' time, there will be more people using the vouchers. As you know, this is a pilot scheme. We are a department that provide services. Of course, we would like all 18 districts to participate, but there are constraints. There are two factors in play when we choose the districts. First, whether there are existing service providers, because without providers or with only a limited number of providers, it will defeat the purpose, because we want to give more choices to elderly people. The second factor is the length of the queue for residential care service and community care service. We have in the end selected the 8 districts. Of course, we hope that the scheme will be extended to other districts or provide more targeted services under the second phase. You test not just one side of the scheme, not just from the perspective of the users. You would also like to test the quality and diversity of services provided. If there is not enough service providers, then you can't choose that district. Then how can you actually test the capability of the service providers and the users? Mr. Tan Ka-piu, well, I see the merits in the scheme. Because this will be conducive to diversification or variety in the service provided in this sector. And at the same time, it will provide assistance to elderly people with cognitive issues, and it also allay the pressure faced by residential care homes. It sounds All right, but there is not enough resources. You don't give them enough. I see that there are 5.6 sessions per week provided in terms of daycare services. But what I hear is that the $6,000 with the 500 will only last for 3 whole day daycare service. The reason why there is a mixed mode because $6,000 is not enough to provide more than 5 days, full day of service. So this is not ideal. I'm not saying that it should be cancelled. I would like it to provide. I would like it to be better. We're talking about 7,000 or so under the daycare service. Can you align them? I don't want you to give the impression that you just try to save money. Will you increase the voucher amount so that elderly people can receive at least 10 sessions per week instead of 5.6 sessions? And if that is to be done, how much more will it cost? Well, currently, you said that you have allocated $380 million. How much will it cost in total? And how will you decide to continue with the second phase? Are there any indicators by which you make the decisions? Well, we have not calculated how much out of the $380 million has been used, because as we've said, some of them have got the vouchers and not used them. The design of the scheme is not to save money. From experience, we see that for conventional service, it's full day, Monday to Saturday or Sunday, 2 sessions a day. But from what we've heard and read from the, say for example, from the report from the Elderly Commission, some elderly people don't want to be tied down for a whole day. Some say that well, they would like to spend maybe some time in daycare service, and for the rest of the day they would like to get some home care service. So the design of the scheme under, say, the mixed mode, for some of the time they would go to daycare. So that is the part-time users. And for some other times, they would use home care service. So it's not the case that we're trying to save money. By making available a lower level of service. And as to whether in the future it will be extended to full-time, we can continue to discuss that. The design of the scheme was to help elderly people who would like to use daycare service for some of the time and home care service for some other time during the day. Miss Helena Wong. I'm more concerned about reasons for withdrawal in the annex. Mr. Albert Ho asked the administration whether there will be studies looking into the reasons for withdrawal. There are 184 people who said that there was no suitable service providers or service packages. I asked the administration to give us more information about the specific reasons. If we're talking about $6,000 a month is rather attractive, then how come that some elderly people would not choose to use the service when there are suitable service providers and suitable service package in your district? Can you tell us what are the needs in terms of service for these 184 people? Has there been any studies done in this regard? Is it the case that in their district there is no suitable service package? Or is it the case that there is no service provider? Or is it the case that there are service providers but they don't provide the service they need? Or is it the case that there are service providers but there is no available places anymore for the elderly person, because all the existing all the existing places have been filled? A lot of members are concerned about the 184 elderly people who have withdrawn from the scheme. We have to ask them more questions. I can't answer for them. Some of them might have just given general answers that they don't like it. And I perhaps if we get more information from them, it will help us too. We'll do it. Please come back to us as soon as possible once you've got the information, because there are instances when you have the money but you have no way to use it. So you have to find out whether there are service providers, whether there are suitable service packages, and whether there are available places for these service packages. Because if there is no available places, then even when you find the right service and you have the voucher, there's no way for you to use it. It's just like you have a winning lottery ticket, but there is no money to give out. I think the 184 cases are under the scope of the study by the Hong Kong U, right? Well, the Hong Kong U proposed an approach to us, and we asked them to cover these 184 cases as well. Please revert to us as soon as possible once you've got the information. Next, Dr. Kwok Ka-ki. At a glance, it's a good scheme. But we're talking about over 30,000 people on the waiting list. If it is a brilliant scheme, then how come that over 500 of them have withdrawn, and the majority of them withdrew because as soon as they've been admitted to subsidized CCS or private or subsidized RCS? I understand that it is not about the quality of the service provided. But if it is indeed a brilliant scheme, then how come there are hundreds of people who in the end can't choose? That itself shows that there are problems. And if it is a flawed scheme and you would like to do more studies, I won't stop you. But we're talking about over 30,000 people on the waiting list. Will the administration learn something from this fact? Will the administration increase the number of places in subsidized homes? If you have a timetable, can you give me the time? Because you can't expect elderly people to wait forever. You talk about an increase of 250 places. I think you're practically joking in the face of over 30,000 people on the waiting list. Can you tell me when you will increase the number of places?
Mrs. Chen, well, let me supplement. Under the pilot scheme, This is a community care service scheme. The 200 elderly persons are being allocated to different services. We want them to have choices, and if they want the traditional models, they are given the choice. And for some of them, they go back to the subsidized RCHEs, and they need to be admitted to those because of their physical condition. So we have to support that. We know that the waiting list is very long. We've mentioned many times at the panel that we would continue to commit resources to provide RCHE places. Starting from this year and for 3 years, there will be 1,500 more places, and there are spaces or land plots reserved for 11 development projects, and we're still trying to identify suitable land size. And we under the special NGO private scheme, and if everything goes smoothly, we will have 7,000 more RCHE places. So these are the figures that we can share with you. For now, we will continue to work hard. Now, on CS, this is just the first phase program, and the money follows a user approach is a brand new approach, and this is also something new for the elderly people. They take time to understand about the scheme. And it's not that we will not be increasing the number of places in conventional service now that we have this scheme. And Ms. Lee has said that for CCS, 230 more places will be provided. And for home care services, 1,500 more places will be provided starting next March. So we will adopt a two-pronged approach. We will work on the conventional services, model of services, and also for the pilot scheme, we will learn lessons from the first phase, and we'll try to cover more people, provide more diversified services in the second phase. I'm just talking about the 30,000 people on the waiting list, not to mention an average increase of several thousand more every year. Now, if you're talking about 7,000 additional or 1,000 places, it's like just a drop in the bucket, no use at all. For those people still on the waiting list, does it mean that going by your approach, well, they wouldn't be able to get any subsidized service in 5 or 10 years' time? For the last person on the list, does it mean that he or she will not be offered any subsidized service in 10 years? I'm sure that the administration will not be able to give you a reply. Well, the figure of 7,000, they're referring to a period of 10 years. So that's a very simple calculation. They won't be able to make that. Well, I think this is outrageous. I'm not talking about you, but I'm referring to the administration. Any other member wishing to speak for the first round? If not, then it's my turn. I would like to raise several suggestions. First, the elderly persons joining the voucher scheme will have to suspend their place on the waiting list. So that's why so few people have joined the voucher scheme. In the first phase, you were doing that, but in the second phase, can you adopt a more open approach to test out how elderly people react? And people will not be willing to join the scheme because they will be taken away from the central waiting list temporarily. So so that's the first suggestion that I would like to make. Second, many members talked about the conflict of interest of case managers. Now, after all, this is just a pilot scheme. So the administration, can you ask your staff members to serve as case managers? Civil servants don't have conflict of interest. So can we try to have some independent case managers in this second phase? Now, there is some information that I would like to ask the administration to provide. Now, there are now 62 service providers. Now, 1,233 are current voucher holders, but then 800 are actively receiving services. But then for some service providers, they have more cases and others were just 0 case. So later on, can the government provide the relevant statistics for these 62 service providers? How many vouchers are they on now? So we'll get a better idea on whether they can survive. It's only when they can survive and they were able to go on operating. Now, if no elderly sort of patronizes them, then they will have to close down. And as far as I understand, most service providers are located within PRH estates, and a minority of them are renting private buildings for their operation. So the rent may be an important factor for them. Also, for the Hong Kong youth study, can we have an interim report? And when will it be available to the LegCo for our reference? Second, would you launch the second phase upon the receipt of the interim report of the study, or do you have a timetable for second phase now? And the paper mentions that the private market or the private sector will be engaged in for the second phase. So what are your principles for opening up? Service providers, how many elders are receiving service, and each service provider, we can provide you with the information later on. But I must emphasize that these service providers didn't start up their business only when there is this voucher scheme. The centers of the service providers already existed before the scheme was launched, and some of them are providing already self-financed services. Some are centers located in PRH estates, some have their own property, some are renting space in private buildings. So that's why they would like to join the pilot scheme. Regarding the second phase, when we started the first phase, we already told the LegCo that the second phase will start in September 2015. Well, there are 2 phases lasting 4 years. In the first phase is September 2013 to 2015, and then the second phase September 2015 to September 2017. So we will stick to our original timetable. We told the same to the Lotteries Fund when we applied for resources. So it's a 4-year program divided into 2 phases. So can I make this request? Before June next year, one way or another, please ask the HKU to give us an interim report, or else we will not be allowing you to go ahead with the second phase. Second round. Anyone in the second round? Ms. Chen Yin-han. Dr. Fernando Zhang, 2 of you. 2 minutes. 1 question and 1 answer only. Ms. Chen. Dr. Fernando Zhang first, because he is the first on the queue. Sorry. A simple point. I'm just worried about the situation of the severely impaired elders. They are not included in the scheme because only the moderately impaired are included. And they couldn't wait for the subsidized RSHEs, and some of them have dementia problems. you said that under the scheme, the elderly persons have choices, and they don't need to go to the daycare centers for 5 days a week, perhaps 3 to 4 days, etc. Now, the idea of aging in place is to allow the elderly to stay in the community as much as possible. But for the severely impaired people, elderly, they have to go to the daycare centers 5 days a week, and they couldn't, be allocated or subsidized residential care service. The only choice they have is to go to the private RCHE. So can they be offered some help? So in the next phase, would you be covering the severely impaired elderly persons? And also, would you consider not adopting a sort of private sector approach to this? Because you are in effect compelling certain service providers to commit resources to such a service, and their existing resources for subsidized services will be thinned out. So please consider covering the severely impaired elderly people as well. In the first phase is just a pilot scheme. We want to adopt a simpler approach, so we didn't cover the severely impaired elderly persons. I believe that for the second phase, we will consider the needs and the services required by severely impaired people, the home care services for them. Ms. Chen Yunhan, I asked several questions. I think we are okay with the principle of money follows the user, and that's a good approach. But for those on the waiting list, what more can you do to help them? The Assistant Director was just about to answer my question. Can you please answer me any good methods to use? The members have been talking about this 30,000 elderly people. They are waiting for RCHE. And some 1,600 elderly persons are waiting for daycare services. Now, for this scheme, some 600 elderly persons have opted for single mode daycare service already. So we would be increasing the number of places of subsidized daycare service places, and we hope that through this voucher scheme, more services can be provided, more CSS services can be provided. Well, in order to convince us, the administration must earmark certain space in a new PRH for taking care of the elderly. You please adopt a pragmatic approach. From now on, I will be going after you for this. When will you introduce a policy that is, you would earmark space for the elderly whenever you build a new PRH estate? Policy question. Mrs. Chen, well, we've had the same view in the last meeting. On provision of RCHEs, this will be an important point in our elderly care services plan. I'm sure that this will be considered seriously by the Elderly Commission, where we'll try to adopt an integrated approach.
This is not meaningful. Well, hopefully the next time I will get some more specific information. You should cater for the need when you build new housing estates. Say, for example, the time when they were talking about developing NTNE, I have spoken to the director for planning. Please don't take me around the blocks. Give me some more specific information. If you can give me the specific information, of course I will support you. I think it involves more than one policy bureau. This also involves the THB. Perhaps we will have to find a time for the different bureaus to to communicate, maybe when we're involved as well. We have spent quite a lot of time on this item. There are criticisms as well as praises. As the director said that in September next year there will be phase 2. I hope that in the second quarter of next year there will be an agenda item to follow up on this matter. Otherwise, you may, if you do not take on board what we've said, then that means the situation will remain unchanged. So I hope that this will be another agenda item before you launch the second phase. Next item is extending the public transport fare concession scheme for the elderly and eligible persons with disability to green minibuses, GMB. We have another team joining us. Assistant Commissioner of Transport Management and Paris Transit, Mr. Albert Su. Principal Assistant Secretary for Labour and Welfare, Ms. Fiona Lee, and Deputy Secretary for Labour and Welfare, Ms. Doris Zhang. Ms. Zhang, are you going to take us through the paper? 5 minutes, is that enough? This public transport fares concession scheme for the elderly and eligible persons with disability, the scheme in short, has been launched fully on franchise buses, MTR lines and ferries a few years ago. Well, we would like to, and it was extended to eligible children with disability aged below 12 in May 2014. Now, there are altogether 1.2 million beneficiaries, and a lot of them, that is 1.07 million of them, are elderly people. And currently, about 720,000 of them, well, there are altogether 720,000 daily average passenger trips as of September 2012. This is done on an accountable basis. Reimbursements will be made to participating transport operators. And that is the difference between the concessionary fare and the fares and the $2 pay. And altogether, we're talking about $506 million in terms of revenue foregone. We would like to extend this scheme to GMBs. Currently, there are 155 such operators with different modes of operation, financial positions, and technical sophistication, and different fare structures. We've discussed with them, and we see that 126 of these operators are interested in joining the scheme, which accounts for 80% of the total number of GMB operators. We've done some studies, and we think that the centralized settlement platform developed for this scheme needs to be improved to accurately record the daily passenger trips and the fare revenue foregone. And in terms of GMB operators, they need to upgrade their fare collection system, because currently a lot of the octopus readers cannot differentiate octopus card of disabled persons. They have to put in place different arrangements to meet the needs of the scheme. As I've said, there are over 100 operators involved, and there is complexity and technical issues to be ironed out. And for different operators, there are different arrangements in place. We hope that at the end of next year, we will be able to start the scheme. We see that for over 100 of the operators, they have done most of the preparatory work, but it still hinges on the readiness of the final stage of work, say for example fair tables audit work and system deployment work. We hope that after the launching of the first batch in 2 or 3 months' time, the second batch will be launched, and this under the first batch, 17 districts will be covered, involving 407 routes, about 83% of the total, involving 2,600 or so green minibuses. There are still 29 operators that are talking to us. We see that the routes run by these operators are now served by MTR or franchise bus companies. All in all, the TD will continue to liaise with these operators and to encourage them to join the scheme. And in June, starting from June this year, the TD has incorporated new conditions. So in the future, when they invite operators to run new routes, they will ask them to join the scheme. In relation to the extension, when it comes to software and hardware enhancement, it will cost $7.8 million. We reckon that the amount of reimbursement made will be around 1 million in 2014 and 15 in terms of GMB operators. We will launch publicity, say for example press release, APIs to inform the GMBs and also the public. And participating buses will have to carry a logo at a prominent position. We will also enlist the help of district councils. We have Ray Chan, Poon Siu Ping, Tam Yu Chung, Tan Ka Piu, Fernando Zhang, Ko Wei Kang, Chen Yun Han, KK Fong, Helena Wong. 7 of them who would like to speak. Well, actually 9. 4 minutes each. But I'll be quite strict with time management. Ray Chan, thank you. Well, there are still 800 routes or so that are not covered by the scheme. Mr. Matthew Zhang, the secretary, talked about the same thing, say for example technical issues, financial issues, when he's explaining to the public. I've asked similar questions in the past. Has the administration conducted any studies to give cash subsidies, say for example to the elderly people to top up their octopus cards? The merit of this is that computer system, hardware systems will not be an issue anymore, and it will also reduce obstacles, wastes, and administrative cost. Some people say that under the scheme, 70% of the trips are made with buses. But sometimes, some people, now they only have to travel for maybe a couple of bus stops, but they have to get on a bus that is, say for example, cross-district, long haul. You're talking about close to $600 million a year. Would it be better? Will it save in terms of enhancement of computer system, putting in place suitable arrangements for auditing or financial arrangements for the operators if you give cash directly to elderly people to top up their octopus cards? Have you done any studies? And if you have and decided against it, what are the reasons? Thank you, Mr. Chan. We have considered your proposal, but as I've said, that under the current scheme, the number of beneficiaries is 1.2 million. And we see that octopus cards are widely used, and a lot of the beneficiaries use octopus cards. This will save the eligible persons from having to make applications as long as they have, say for example, an elderly octopus card. At the time when the scheme was launched, we have undertaken in LegCo that we would conduct a full review, including what Mr. Chan said, that is, whether we will consider other modes of subsidy. And when it comes to short-haul passengers taking long-haul buses, but we see that at the beginning of the scheme, yes, some people did do that, but now that it's been quite some time, we see the situation improved. Mr. Su. I think what Mr. Chan was talking about was related to the initial stage of the scheme, because at the beginning, when elderly people travel, they may not know the best route. And as a result, there are a lot of elderly people who are taking long-haul buses for a short trip. But now we see that it is not a prominent situation anymore. We will continue to monitor the situation. We believe that when the scheme is extended to GMP, when elderly people have more choices, then this situation, that is, passengers taking long-haul buses for short trips, will improve. Or do you have the figures for that? And what is your assessment? How did you do the assessment? I don't have the figures now, but what we've heard at the beginning was that elderly people would take cross-harbour tunnel buses when for short trips. But I don't see how you make the assessment. We will continue to monitor the situation, but do you have the figures? Say, for example, number of passenger trips. I don't have it with me, but we'll give it to you after the meeting. Next. Just now, the administration said that there will be two batches for GMB operators. Can you give me information about the routes that are involved? You told us that about 20 operators are not joining. What are the reasons? Is it because of financial difficulties or technical difficulties? Have you done anything to find out? I know that when it comes to new contracts, you would ask operators to participate, but is it mandatory? And when will these and how long will the contracts be? Some people are concerned because during peak hours there may be more elderly people using the service, but there are only 16 seats in GMBs. How can you ensure that there will be sufficient service provided to meet the demand during peak hours? Mr. Su. But if you would like to know more about the routes, we will collate information and revert back to you. And out of the 29 operators, well, some of them have already triggered the participating process and making preparations to align their internal systems with our centralized settlement platform. For others, maybe they will need more time for discussion among board members about financial arrangements and various other issues. We will continue to encourage the remaining operators to participate. The license will last in general for 3 years for GMBs. And if we are satisfied with the service, normally we will renew their license.
We've heard members' views that they should be encouraged as much as possible to join the $2 scheme, but we must emphasize that to existing operators, I hope that they can do so on a voluntary basis. This has all along been the essence of this scheme, and we would continue to liaise with them and hope that among the shareholders of these operators, they can come to a consensus as soon as possible, and they can overcome the technical and the financial difficulties and join the scheme. about the traveling demand at peak hours, you don't have to unduly worried, because the minibuses services are quite flexible. According to our observation, even during peak hours, especially at routes plying via PRH estates, there are elderly people who ride on minibuses to go to do various activities and so on. So even if the scheme is extended to green minibuses, that will not be a problem. We'll keep close tabs on the elderly people's commuting habits, and then if needed, we will further discuss with the GMB operators on how to enhance the services. Don't be worried. Mr. Tam Yu-Cho. The $2 concession scheme is very much welcomed by the elderly people, and they are keen that this scheme be extended to GMB. Now, the government said that after discussing with the GMB operators, the scheme can be launched before March 2015. So which exact day would it be? And we also heard that there would be a phased approach. So how would that work? If you can give us more information, then that would be good. And we are covering only 80% of the minibus routes, and 20% are not joining the scheme. Now, for the 116 routes, will they be divided into different phases? How many phases will there be? Well, don't make things complicated for the elderly people. Now, if you can announce the details of the 116 GMB bus routes as early as possible, then that would be good. Many GMB are working together with other public transport modes to offer interchange fare concession. So have you considered that? What's the situation on that point? Thank you, Mr. Tam, for your question. Once the information is ready, we would make an announcement as soon as we can. Most of the routes will be covered in the first phase. There are 116 operators. They started preparatory work early, and most of the preparatory works have been completed. And if the remaining works can be completed soon, and in the first phase, around 75% of the operators will be included in the first phase. Second phase, 16 of them are not going very far in the preparatory work, so they will be covered in the second phase. And for the remaining 29 GMB operators, as pointed out by Mr. Su, they need more time to make a decision, pending, say, further discussions among the shareholders. So we don't want to divide the scheme into too many phases, perhaps 3 to 4 phases. Interchange fare concession, Mr. Su. Some GMB operators are now offering interchange fare concessions among the different GMB routes and also between them and the MTRCL. Well, these are time-limited fare concessions, and whether they can continue depend on the changes in the patronage and so on, and the affordability of the operators. I think, technically speaking, we can maintain these interchange fare concessions, and if the GMB operators wish that to be done, then there's not a problem at all. In the course of our discussion, we have also considered this point, and if GMB operators still want to offer these concessions after the scheme has been implemented, we would be more than happy to provide the assistance and let them do so. Will there be more concessions or less, or what? They are offering concessions not just to the elderly persons but also other travelers. So if they want to maintain the interchange fare concessions, they can still do so under the scheme. Well, as to the amount of the concession, then it depends on the agreement among the various operators. Mr. Tan Ka-piu, I have two questions. Um, 83 routes are not joining the scheme. And you said that, well, their routes are now served by MTR or franchised bus companies. You can't be so general in your remarks. Does it mean that all of the districts not covered by the GMB routes are served by MTR or bus companies? Can you be more specific? Are there alternative transport modes for all these 83 GMB routes? Now, there will not be any amendment in legislation, and you also talked about revenue foregone. Now, among the for the franchised buses, MTRCL, and ferries, for the revenue foregone given to them, is it the case that you don't need to seek funding application or seek funding from the FC? Is it the case? Thank you, Mr. Tang, for your question. We submitted the plan to the electrical in 2012, and then we got the funding application from the FC before we proceeded with it. We are now suggesting extending the scheme to GMB, and there will be additional costs. Say, for example, software, hardware to the computer system. We need 7.4 million to do that. And for this financial year, the revenue foregone is $1 million. That's an initial estimate figure. And that is will be part of the approved cost estimate for the entire scheme. And if needed, we will be under the established mechanism to do it by the way of transfer of powers. Now, for 2015, 16, and 16 and 17, for the amount needed, then we would seek funding from the LegCo in the respective years. So for this financial year, we don't need to go to FC. Well, later on, you will be also covering the children with disabilities under 12 years old. So is it the case that you would be doing the transfer of powers approach and then you don't have to go to the FC? Well, actually, that the plan to extend the coverage to children under 12 years was approved and implemented in earlier this year in May. Replacement routes for 83 routes. Most of the routes ply via housing estates, and apart from the GMB, there are indeed buses serving these estates, taking the people to MTR station. I can't say 100% that this is the case. Well, it depends on the individual situation and location of the housing estates. I can give you more detailed information later on. Dr. Fernando Zhang. Chairman, I'm most concerned about the fact that not all GMB come with barrier-free access facilities. And, for example, PWDs and wheelchair persons cannot take GMB. And for those who are quite physically immobile, it would be hard for them to take the 2 steps up to the GMB. For the hearing impaired people, well, they would have a hard time asking the drivers to stop at a certain stop. Well, theoretically, some GMB come with the bells, but then most of them do not function. So for the hearing impaired people, it is difficult for them to take GMB and also even the buses. So my question for the administration is, when will you do more? When will you improve? And actually for buses and GMB, you can have a sort of platform and to facilitate these PWDs. And for the very back seat of the GMB, it can be converted to a space where wheelchair persons can use. Now, if wheelchair persons have to go to a medical consultation via GMB, then it's very hard for them. Can you consider subsidizing GMBs to install such rising platforms, and then helping GMBs to reserve space at the rear part of the GMB for use by wheelchair persons? If wheelchair persons are not using that space, the space can still be used by normal abled bodies, other passengers. So the GMB operator said that they are willing to do this. What's the response of the government? Will you help them? Thank you, Dr. Zhang, for your question or comments about the bell on GMB, and we would go back and talk to all GMB operators to make sure that these bells are properly maintained and repaired. Now, turning GMB into or installing BFA facilities on GMB, I know that Dr. Zhang has been raising this comment for a long time. When it comes to the hardware, we have to be very careful to see whether the operation mode of GMB is well suited to install BFA facilities. Well, if that is to be done, it will affect greatly the operation mode of GMB and also their operating costs. So we have to be very prudent. And for some routes, GMB routes going to hospitals, whether services can be provided to wheelchaired persons. In the past 1 to 2 years, we have been providing rehab buses to those in need. Starting last year, we have a dedicated rehab bus routes taking wheelchaired persons to the hospital. So we will strengthen the service in the next couple of years. And I think it takes time for us to consider or study whether BFA facilities can be installed on GMBs. Talking about rehab buses, there were some 14,300 applications for the use of rehab buses were rejected, and 7,000 of them were really have to do with taking handicapped or wheelchaired persons for medical consultation to hospitals. I think you can just install the BFA facilities on some green GMBs. You don't have to work on each and every one of them, perhaps 1 in 5. Mr. Kwok Wai Kang. I think it is the public's aspiration for this $2 fare concession scheme to be extended to cover GMB. We've received many signatures calling for that at the district. Well, that will be realized in March next year, and among the 155 operators, only 126 are interested or will do it. And for those remaining, the transport official said that may still be a matter of discussion among the shareholders. Now, I would like to pose this question. If we are allowing the GMB operators to do it on a voluntary basis, will it be unfair to the GMB passengers? Because the GMB operators have all the say, have the final decision. Well, will there be other reasons other than that there is not a consensus forged among the shareholders of an operator which is not joining? Will there be an implication on the revenue and the cost and so on? In Hong Kong, Kowloon and NT, and actually many GMB buses take passengers to hospitals, and they are heavily patronized by patients and elderly people.
I'd like to ask the department and your department and the TD, are there any ways for you to get the GMB operators to participate in the scheme so that all eligible persons can use it? And I have a question. It says that the TD has been asking for data from the Octopus Card Company. Does it incur additional administrative fees? Well, I'm sure that the Octopus Card benefit from it because more people are using Octopus cards. But will there be additional costs? Mr. Su. In reply to Mr. Kwok's second question, apart from Octopus cards, we also get information from operators about passengers, and in this regard, we have not paid additional cost to the Octopus Card Company or operators. In relation to the first question, as for the remaining 29 operators, some of them have already started to make preparations to participate. For the rest, they are having discussions with board members about financial management. It is an internal matter. As long as they would like to start to make preparations for technical arrangements, we will be able to get them to join. We hear the strong view that they would like to have more operators participating. Well, over 80% of the operators are participating in the scheme. That itself is an incentive for the remaining ones to join, because it sends the message that if they do not participate in the scheme to provide the concession, it may not be a good it may not be favorable for them to continue to operate. Of course, we will continue to talk to the remaining operators. If in the end there are still some operators who don't want to join, we will consider other ways to get them to join. Yes, I think the most important thing is that everyone can benefit from it. Ms. Chan. Well, my first question is like those asked by other members. For the remaining ones, you should take the initiative to do something more to get them to join instead of waiting for the board members to complete their discussion, because a lot of elderly people are waiting to use GMBs. And I've been asked why red minibuses are not covered. Say, for example, well, I have to use a red minibus when I go home. And the second point, well, the first one, I don't need an answer because it's a comment. And the second one, for those who are mobility impaired, they may not be wheelchair bound, but it's difficult for them to step onto a minibus. If there are no bells installed, you'll have to shout at the top of your voice, just like I did, just to get the attention of the driver to let you off. I think the idea itself is good. The scheme itself is good. The TD will have to do more to make it easier for elderly people to use GMB. The elderly people are happy with the scheme. I want to add that. Will you talk about some transfer? So with the endorsement of this panel, you will have to go to the FC. What about CSSA or the OALA Can you use the same approach? I've just visited some districts, and I am aware that there are strong views because funding approval will have to go through different meetings. People ask us for help. They don't even know that there are some other proposals in the pipeline. I think the administration should take the initiative to find better ways to deal with the plight faced by elderly people. Thank you, Ms. Chan, for her suggestion. There are different financial arrangements for different proposals. When it comes to this scheme, we're talking about 7.4 million when it in relation to all the costs involved. So it is under $10 million. So we are able to deal with it with a special approach. And in relation to the extension to GMBs, is only an additional cost of $1 million. So I think there is no need for us to go through the FC. But for different projects, the situation is different, so I cannot speak for them. I would like to get more information about a question asked by other members. They said that there are still a number of routes that are not ready. But I think when you inform the operators, you would inform the associations. Some of them have already started making preparations. I would like to know, for the others, why does it take them so long? Can the administration do something to speed it up, to help them? Why does it take some associations longer than others to agree? Do you know about the reasons why others are slower to join than others? Mr. Su? As far as we know, the difficulties they encountered is in relation to the operation and the arrangements among the different holders. Say, for example, the settlement arrangement between the operator and the Octopus card. They may be a limited company, but very often 2 or 3 more shareholders are involved. We need to use a centralized system using the Octopus card company as in the settlement. We know that for some operators, they have not agreed as to who is to be in control of the accounts or who will be a representative in this regard. When we decide whether to renew their license, we've always looked at their service performance and whether they have met all the indicators. When it comes to financial arrangements, it's difficult for us to get involved. We've been explaining to the Octopus company about the arrangement and about the auditing requirements. And in the future, once an agreement is made among the shareholders, we hope that our explanation would put their minds at ease. We encourage the operators to start as soon as possible to deal with the technical arrangements to align themselves with the centralized platform. And we can, at the same time, work with them once they've started. We do not give up easily. We hope that they will all participate in the scheme. Mr. Feng. Well, but a lot of operators have started the discussions late. If I remember right, the proposal was first floated in 2013. Of course, we want everything to be sped up. So, what is the obstacle? Is it in our court or in the administration's court or in the court of the operators? We have informed all the operators, but some operators would like to observe for quite some time because they don't have full confidence. Yes, indeed, some operators have started late, but it doesn't matter. As long as they're willing, we will help them to speed up the process. Last member, Helena Wong. I strongly support the scheme. I hope the administration will do better. Now, over 80% of the operators would like to participate. I hope that you will encourage the remaining ones to join. I would like to ask about the red minibuses. Are there any reasons why you have left them out? Technical reasons or some other difficulties? Ms. Zhang? The mode of operation between green and red minibuses are very different, because red minibuses is not regulated by the administration when it comes to, say, their fare structure. So if they are to be covered, it will complicate the issue significantly. So at this stage, we would like to cover GMB first. Does it mean that once you have covered GMB, the administration will study about covering red minibuses as well? We do believe that that will be a lot more difficult, because the administration will pay the operator the difference between the $2 and the fare. But for red minibuses, the fees charged is quite volatile, so it's difficult. As far as I understand, 29 GMB operators are not interested. Why? Can you solve the difficulties for them? Or is it the case that they simply decided not to join? Now, elderly people would, take buses, but once the scheme is extended to cover GMBs, that they may take GMBs. Would you consider extending the number of seats in GMBs? Well, the 29 GM buses, they said that they are interested, but they have started late, and they have given the information to align their arrangements. As for the others, as I've said, that the shareholders have not reached an agreement, say when it comes to financial arrangements. Well, I'm talking about the 29 GMB operators. In the latter case, we will continue to talk to the 29 operators. We would relay the message that the LegCo and the general public would like them to participate.
Also, members don't have to be too worried that there will be too many elderly people taking to the GMB after the scheme is launched. Actually, many GMBs are serving public housing estates. Even without the GMB concession scheme, the elderly people are still already taking GMB to do all sorts to go out to do all sorts of activities. So the impact will not be too great, we believe. We will closely monitor the situation, and GMB operate in a more flexible way, and we would monitor the changes, if any, and then work with the GMB to enhance services if needed. Increasing the number of seats on GMB, that has no direct relationship with this $2 scheme. We have to consider the overall picture of the development of public transport before we decide on whether a certain mode should get the number of seats increased. We would do more studies on the changes in patronage of GMB. Second round, 2 minutes. Mr. Tan Ka-Piu. A quick one from me. A member mentioned about red minibuses. And we hope that all elderly people in Hong Kong can benefit from this $2 scheme, GMB scheme. In remote outlying islands, there are no GMBs. They have just kaitos. Would you consider extending the concession scheme to kaitos? Because the elderly people don't have any other public transport choices there. Would you talk with the kaito operators and take this forward? Thank you, Mr. Tang. Before we extended the scheme to ferries, we already considered this. Kaito operators have to obtain a license from us, but their fare is not monitored or regulated by us. Well, it depends rather on whether there is a demand to, and most kaitos serve tourists going on holidays or to remote outlying islands. So at this juncture, we don't have any plan to extend the scheme to kaitos. Well, please think about this. Some people actually live on these islands, Po Tai Islands. So for example, there are some 20, 30 elderly people living there. And, well, you can sort of negotiate with these kaito operators. Well, because we're talking about a scheme on a voluntary basis, why don't you talk to them first and see if they are willing to join the scheme? Any reply? If not, then perhaps you have listened to our views, and after we're finished with the GMB scheme, consider the kaitos as well. Well, I think we have to wrap up the discussion. And before the January 2015, the government will revise the Schedule 5 of DDO Cap 487 to ensure that the scheme will not contravene the DDO. Next agenda item. Now, I would like to seek members' views. We have one agenda item and one AOB. Can we extend the meeting time by 30 minutes? Well, no objection, then we'll hold the meeting up to 1:30. All right, the next item is annual adjustment of Social Security payment rates under the Social Security Allowance and Comprehensive Social Security Assistance schemes and issues relating to rent allowance under the CSSA scheme. So, a number of government officials are joining us. Mr. Donald Chen, Deputy Secretary for Labour and Welfare. Ms. Maria Lau, Acting Deputy Director of Social Welfare. Mr. Ng Wai Kun, Chief Social Security Officer, Social Security, and Ms. Cecilia Chan, Senior Statistician, Social Welfare. Welcome. Mr. Chan, can you brief us in 5 minutes, or better still, less than 5 minutes on the paper. I'll try to be very brief. We would like to seek members' support to our proposal to adjust the SSA rate of allowance and CSSA standard payment rates based on the established mechanism. The recurrent expenditure on these items is $390 million in 2014-15, taking up 30% of recurrent expenditure. And 1.15 million people have benefited from these two schemes. And the established mechanism is that the SSAIP is used to adjust the rates. There will be an upward adjustment based on this mechanism next year up to September, end of September this year. The adjustment rate can be 4.2% up, while the ultimate figure will depend on the statistics up to the end of October. That's what we've been doing over the past years. Now, if we are to adjust the rates by 4.2%, OALA will be $2,380, and OAA $1,230. And December, we will seek funding support from the FC. And then we will be making the proposal based on the statistics up to the end of October. If FC gives the green light, over 1 million people will be receiving the new rate starting from the 1st of February next year. And also regarding the maximum rates of rent allowance, MRA, we will be adjusting it based on the CPIA rent index. And that is to reflect the trends of the lowest income group in the community. Over the past 3 years, we have adjusted upwards 21%. And the new rates can take effect 1st of February 2015 up to the end of September. The rate upward is 6%, and based on the established mechanism, we will be using the statistics up to October to make the relevant proposal. Well, this is a funding a matter related to finances, so all members are invited to this meeting. So I would like to remind members that under ROP 83A, at the meetings of the panel, if members have direct or indirect pecuniary interest on a matter, he should not move motion or speak unless he has disclosed the nature of his interest. So I would like to remind members that if members have direct or indirect pecuniary interest on this matter, they should disclose the nature of that interest before they speak. So I'll now open the floor to members. 4 minutes. Order. Raymond Chan, Fernando Zheng, Dan Carpio, Fung Kim Kay, Chen Han Pan. Mr. Raymond Chan. Thank you, Chairman. Well, different political parties within the electoral would support adjusting upwards the rates. Mr. Matthew Zhang on the TV and in his blog and also in the paper hoped that the funding approval can be given by FC in before this year, and that the effective date will be next year, February. Well, and he's worried that the non-cooperation movement will block the progress. Now, I hope that Mr. Matthew Zhang can be here today to discuss with us. Well, he just appeared on TV. He just wrote on his blog. He didn't come to discuss with us. This is most regrettable. Does the government know that for the rest of 2014, how many FC meetings are there? Just 6 days. So when do you plan to submit this for consideration by the FC? And do you know that how many outstanding items are there at FC? 17. The Yanbi if it is optimistic, that the discussion of the 3 landfills and 1 incinerator will take us up to the end of December. So, well, if we can pass each of the landfill proposal at one meeting, then that would be very good. So it's totally impossible that the FC can endorse these proposals in December. Well, this is raising false expectation among the people in Hong Kong. Well, unless the government can sort of swap the agenda items, or else you will not be having this passed within this year. We have 17 outstanding items to deal with, not to mention that there may even be filibustering. Mr. Matthew Zhang, that in his blog has this heading, he is working for the good of the grassroots, but I don't see how he is working for the grassroots. Do you mean that ITB is more important than adjusting the rates for SSA and CSSA? What is the government's response on this? Well, we have to take on board the statistics in October. So that's why the earliest time that we can submit the proposals to FC is in December. I mean, this is an agreed mechanism and timetable all along. So which exact date in December are you referring to? We have to get the statistics from October, and that will only be available by the end of November. Once we get that, we would hope to submit a proposal to December. Mid-December, do you admit that this cannot be realized at all? I don't want to make any presumptions or assumptions. Well, you're not making assumptions. This is the reality that we are facing. How can these take effect in February 2015? Look at what is happening at the electrical. Now we have 17 outstanding items. Even if we can get each of them passed in, say, half a session, we will not be able to finish them by December. Well, the administration is working to its own timetable, but the political reality in the electrical is another thing. While I understand what you're saying, well, we will still ask questions on the Innovation and Technology Bureau. Now, if you can get this commenced in February, then you are criticizing the FC, then it's not fair. All right. Next one, Dr. Fernando Zhang. Mr. Matthew Zhang is hypocritical. He wanted to the public to have the impression that the electrical is disregarding the interest of the disadvantaged groups. While the government can easily advance the items relating to the disadvantaged groups in the agenda of the FC, now they are putting them back, and you are trying to use this as a tactics to force your proposals through the FC, and you are really like holding hostages of the disadvantaged groups. I think this is most disgraceful. Now, coming back to these established mechanisms, there are some problems. In the report of the Poverty Commission, it is stated that some 400 households are below the poverty line, and then among them, 100,000 of them are on CSSA. So these people are still living below the poverty line. So I think this is something that calls our attention. Does it mean that the CSSAs cannot meet with their basic living expenses? Now, since the handover, we haven't conducted a review, and we've raised this for many times, and they they refused to do it.
第二呢，
And there is a lag time, and we've said it an umpteenth time that for poor people, they always have to wait for the inflation to increase for a year before they receive an increase in subsidy. Looking back in the past 18 years, the CPA, there are only 6 years when we see a deflation. Most of the time is an inflation. In the past, we have used a forecast when it comes to inflation so that the poor will receive the much-needed subsidy in time instead of having to wait for the lag time. And another thing I would like to say is that the rent subsidy can never catch up with the increase in rent increase in the private sector. About half of the recipients see a shortage between the subsidy they receive and the actual rent they have to pay. Can you do something to help them catch up? Because we're talking about 50% of the recipient. You expect them to eat less, spend less on food to subsidize the shortfall in rent. First, I'd like to talk about the adjustment mechanism. As I said at the outset, we would make adjustments in accordance with the SSAIP, Social Security Assistance Index of Prices. This is well practiced and it's been in use for a number of years. Apart from that, once every 5 years, we will renew the items covered under the SSAIP as a result of the household survey done. Apart from the annual adjustments and the update once every 5 years, at different times we have introduced improvement measures under the CSSA scheme. This year, in order to improve upward mobility and to promote employment, we have increased the standard rate by $1,000, and we have also included university graduates in the calculation of the average rate, and there are also some subsidies to encourage employment. When it comes to the lag time, as we pointed out in the past, in 98 and 99, the audit has conducted a survey, and the finding is that if a forecast inflation is used, more often than not, the figure is higher than the actual inflation rate, so there are problems. If we use a predicted or forecast, there is always a difference, and it will be difficult for the recipients to make adjustments when an adjustment is made. And now we use a rent index for private housing under the CPIA to make adjustments. This time round, apart from the adjustment, the Community Care Fund has decided to offer one-off subsidy starting from 2014 under established mechanisms to provide assistance. So apart from the annual adjustments and the CCF subsidy, about 66% of the recipients will be able to use the subsidy in rent to cover the actual rent paid. If the rent subsidy will have to follow exactly as the change in rental in the private market, it will further push up rental level in private housing, which in turn will add to the burden of non-CSSA households. So with the adjustment and the CCF assistance, I think that should be sufficient. I think they're just a recorder talking about the same thing. Well, I have written a motion, submitted a motion about moving forward certain items for this FC. We'll deal with it later. We have to stick to the 4-minute mark. We may relax it a bit, but we should know that there is little time left. Next, Mr. Tenka-Pio, 4 minutes. Thank you. Well, I don't agree with what the two members said about the FC arrangements, because there is a queue. You have to stick to that. If you engage in bickering at the expense of the welfare of the general public, well, that you have to take that into consideration. Well, I just learned that for the GMB, there is some kind of a delegation of power so that they don't have to go through the FS even when there is an additional funding application. I see that for the FC, currently the items there is a backlog. I do think that the current adjustment is not ideal, but there is a mechanism in place. Since there is an annual adjustment every year, then why do we have to go through the FC every year? Are there any ways for this to not go through the FC to save some time? Well, as I've explained that there are some other exemptions and approaches that they don't have to go through the FC. When these mechanisms have been agreed upon, and if you agree on some new approach or new mechanisms, then we don't have to go through FC. So does it mean that if we agree, then there is no need to go through the FC? No, there is still a need to go to FC. So in the end, you have to go through FC to seek their approval. If indeed there is a change, you will still need the approval of the FC. I believe that there is a queue this year. Next year it will be the same. Of course, if we can find a way to resolve this, it will be better. But in any event, this year, I don't think that it will be endorsed by the FC before December, unless some people are willing to put their differences down. So there won't be any payment made in time from 1st of February. If that is the case, are there any mechanisms to make retrospective payment? Well, that should be on a special case basis. Say, for example, if every year there is the adjustment in accordance with an established procedure, then there is the retrospective arrangement, and this classified as one of those arrangements. But even with retrospective arrangement, it is not ideal. Say, for example, if you paid a lump sum after February, you may get the money, but it's late. I hope that some members will put down their differences and let the items go smoothly. KK Fong, I think paragraph 12 is wrongly put. You have to add that in December 2014, the administration will seek the FC's approval after they have put the item on the top of the list. Well, because if it is done in the normal queue, it will not be endorsed. before, well, it will not be endorsed in December. So this is irresponsible. And you're in a way cheating our elderly people and the CSSA recipients. I do not agree with the member when the member said we should put down our differences and stop bickering. Does it mean that we should not have any discussions about all the 7 items and just let it go through by agreeing to every single thing blindly? We're talking about controversial items. For the incinerator and the landfills, it's not about the non-cooperation movement. Before we have this movement, there has been a lot of contentious discussions on this item. It's not the case that you can ignore what is actually going on. You can ignore the facts because all these different opinions are there from different districts. Look at the letters written by Mr. Lau Wong-Fat. Is it the case that the administration completely disregard the facts and say whatever they want? And in relation to rent, let's look at Annex 2. I see some 2 major problems. First, for 1,535, well, Sham Shui Po is a poorest district. What can you get for 1,535? Not even subdivided flats. And I think for 2P, 3P subdivided flat, you will have to time this amount by at least 2 or 3 times. We're talking about 100 or 120 square meters. For 1P, PRH is bigger than that. And for 2 or 3 Ps, it's about 130 square meters. It's about 200 or 240 square feet. So these people will have to live in 100 square feet and pay $3,000 in rent. And that's only about 40% of the size of a PRH unit for the same household size. I have to say that for the rent index, it has to be broken down into different districts, say urban areas and other areas, because that is insufficient to pay the rent in an urban area. There are districts where the rent is a lot higher than others, and as a result, with the same rent index, that is a miscalculation. Well, as I said, that the timetable set out in the paper was endorsed by the panel, and we stick to that. Number of members talk about the order. I know that the FSTB sent a letter to the chairman of the FC to explain the stance of the administration, because all items are equally important, so it's very difficult to change the order. When it comes to rent, as I've explained, apart from the existing mechanism, there is a special assistance under the CCF for 1P is 2,000, for 2P or above 4,000. But that's one-off, not an annual payment or recurrent payment. But I'm asking you to resolve this problem once and for all. You cannot answer my question. Well, I don't think they can answer your question without a comprehensive review. Mr. Tan Kap Biu. Well, I think the administration follows the established procedure. They come to the panel before going to the FC. We hope that all funding applications can be dealt with as soon as possible. Well, when it comes to works, there is a deadline because, say, for example, there is the tender exercise. And if we miss that, we stand to lose. There are a number of projects that have seen delay. And tender exercise had to be launched again, and the public, in effect, have lost maybe tens of $billions for various reasons. Some members hinder the progress, and I think it is regrettable.
I hope that the administration can submit the proposals to the FC for funding as soon as possible. I would like to focus on rent. The rent adjustment is based on the rent index, but we know that a number of people on CSSA are renting subdivided units, partitioned flats, and so on. And the rent index for those types of housing would be higher than the average. Earlier this year, someone told me that he is renting a one-person house flat, $4,500, and recently it's gone up to $5,500. You can imagine this is a hefty increase. Now, your proposed rate increase, well, a lot of people will not be able to cope with that increase. And your paper says that only 50% cannot cope with your rent allowance. And this group of people have to save on clothing, meals, and so on, or else they would not be able to rent a flat with your rent allowance. So when will we conduct a review on the base figure for the rent allowance? Or else you should be building interim housing for them, or else they would not be able to survive. First point, apart from the rate adjustment and also the special program offered by CCF, then the number of people who will benefit will increase to some 60%. And the rent problem has to do with the housing problem, and the ultimate solution lies in providing more housing. If we are to adjust the rent allowance based on the actual rate increase, then that will create a problem of driving up rent and driving more people to go for CSSA. So we will stick to the established mechanism, and we have the CCF to help us out a bit too. Well, even with the CCF program, 40% of the people will not be able to rent a house with the existing rent allowance. I find it very strange that the administration refused to conduct a review. Mr. Lee Chak-yan. First of all, I would like to Mr. Tang Ka-Pew to butt in. And he is suggesting that proposal should not go through FC. I don't think it's reasonable, because we do have questions or problems with the adjustment mechanism, because there is a lag. The poorest people have to bear the brunt. And the past mechanism was not like that. In the past, we have this inflation-focused methodology. So we are asking that we revert to the old mechanism. I think Mr. Matthew Zheng is hypocritical. There is a lack under the existing mechanism. And he said that he hoped to launch or commence a new rate in February. Well, if you want to do that, why don't you place these items as a first item in the FC's agenda? FSTB said no already. I am not putting my question to FSTB. I would like to know the stance of the Secretary for Labour and Welfare. Is it the case that the LWB has no say at all? Is it Matthew Zheng is dumb or what? So we ask that Matthew Zhang once the rate has been fixed, request that this item be placed as the #1 item in the FC agenda. If this is not done, well, I think Mr. Matthew Zhang is negligent on his duty. Well, if he doesn't do that, don't write what he wrote on the blog. He was pretending to be kind-hearted. Well, just bury the proposals among the landfills. He's not being sincere at all in making the adjustment. 2 questions. Will you put this on the top of the agenda? LWB, will you do that? Second, would you be adopting the forecast approach instead of the present approach where there is a lag, time lag? Deputy Secretary, the FSTB has written to the FC chairman, and this is the overall stance of the entire government. So does it mean that the LWB will not sort of fight for it? Well, the FSTB has taken a look at the whole picture to come up with that their stance. Now, as to the question of the lag, time lag, the Director of Audit, and based on past observation and based on our past experience, then there may be cases where there is an overestimation, and that would beg the question of whether the public monies are being spent properly, and that will also have an impact on the beneficiaries. You don't want to adopt a forecast approach. You are asking people to suffer from inflation. So this goes to show that you are not being sincere in improving the lives of the poor. Second, I'm very disappointed. You said that the FSTB speaks on behalf of the entire government, but LWB, aren't you obliged to strive for the early implementation of the new rates? I don't think there is a sincerity on your part. Don't try to pretend to be kind-hearted and nice. Next one, Mr. Chen Yunhan. We have to be very clear about the issues. In the last round, or in the last agenda item, I discussed the power issue, and they had the discretion to get something done when it is below $10 million. Well, can you do the same here for this agenda item? Deputy Secretary, you should answer Mr. Tan Ka-pil's question. Well, if you want to take the proposal to FC, that's all right, but then that you will receive so many views. The question is how to try to disperse the money as soon as possible in the midst of the difficulties we are facing. Well, the public at large would not be able to differentiate sometimes among the pro-establishment camps and the pan-democrats and the other camps. Well, I think all of us to work together to try to find a solution. Don't try to blame others. Regarding the adjustment mechanism, I have problems with it. You haven't answered Dr. Fernando Zhang's questions. Well, now only 50% of those living in private housing are able to pay all the rent using the rent allowance. And also, people living in residential institutions are affected alike. Deputy Secretary, go back and study this. Poor people living in private housing and people in residential institutions, they are facing rent problems. Go try and think about solutions for them, how you can help them. Well, these questions and problems have not been raised here for the first time. We've been talking about this for so long. Perhaps you can give us a timetable. Well, don't use the excuse of the Director of Orders remarks once again. Those living in private housing are in a plight indeed. And the elderly people are also at a disadvantage. So, Deputy Secretary, please don't rehash the old lines. We have all sorts of opinions on these kind of issues. Perhaps you may not give me a solution today, but at least tell us that you undertake to study these issues. In the last agenda item, I also asked the administration to earmark space for facilities for the elderly when they build new housing estates. Well, the same logic applies here. Well, try to study it. Deputy Secretary. The real problem lies in the inadequate housing supply. When this is the case, we can't increase the rent allowance to cover all the total amount of rent payable by those in private housing. And Chairman, well, please don't get yourself sort of mucked up by political realities or problems. You should have the courage to take things forward. Now is my turn. Well, the kind of remarks that we are making today are made each and every year on an annual basis. We are sort of speaking like recorders, and you are speaking like recorders too. And I don't want this to happen again next year. Go back and think about all these. I have a simple point. The rent allowance is standardized across all of Hong Kong, but then rent levels are different in different districts. So can you try to obtain information from the CNS department and try to add some weighting, say to Sham Shui Po, Central Western District, and so on and so forth? You may say that you would jack up rentals, what you can do is to, as a way out, is to try to sign an annual rental agreement with the landlords. Well, I know that many flats come without rental leases. So if we have certain conditions set out in the lease, then that would be a solution to the problem. I think as long as the government has the will to do it, then they can come up with all sorts of solutions. I'm afraid that they just lack the will. Also, Dr. Fernando Zhang at 1:05 submitted a motion. But then, because it's 5 minutes past 1, the official end time of the meeting, so that motion could not be moved. The motion was rather simple. It's asking the government to advance or move forward this item in the agenda of the FC. So I would like to solicit members' views on this. Whether you would like these proposals to be placed, say, at the first part of the FC agenda. Since Dr. Fernando Zhang's motion could not be moved, I would suggest that the chairman would write to the secretary and then asking the secretary to advance the item to be the first item on the FC agenda.
And that is something I can do within my power, Ms. Chan. Well, first of all, I think that is feasible, but I'd like to add, well, are there any other ways? Because if we rely solely on changing the order, I'm afraid that we already know the answer. The DS said is the FSTB, but can we maybe explore other possibilities? Say, for example, using the LCPNP? Well, I will ask the clerk to collate the points and write a letter to the secretary by the chairman, Mr. Tang. On a number of occasions, the administration's representatives have already stated their stance. Well, you can send a letter to the LWB, and I think what works better is to end this non-cooperation movement as soon as possible. But this is the WSP. I think we should do what we're here to do. And I know that there are other people who are doing something else, hoping to achieve something. There's no harm doing different things at the same time. I will end this item if there are no other questions. Well, I think we should have Plan A, Plan B, plus waiting. Next item. Well, I thank the administration for attending. Next is a very quick item. I would exercise my power to extend this meeting by 10 minutes to deal with the last item. This is amending the name in terms of reference of the Subcommittee on Strategy and Measures to Tackle Domestic Violence. This is in relation to a letter sent by Dr. Fernando Zhang. Well, I'll give you 2 minutes, Dr. Zhang, to take us through it. It's simple. We would like to add the item of sexual violence. Because if you recall, in the last term, sexual violence is included. I've already set out the scope of issues to be covered by this subcommittee. 2 members would like to speak. Ms. Helena Wang to be followed by Ms. Chen Yunhan. I agree fully with Dr. Zhang. We have to add sexual violence. Last year, there are 700 of sexual violence cases in Hong Kong. I do think that it is most appropriate to add this to the terms of reference. I agree with the letter of Dr. Zhang, but I'd like to add and change something. D. Preventive measures on domestic violence and sexual violence. I hope that we can add education. And I would like to delete the word children and to change it to leading to deaths, because deaths resulting in domestic violence and sexual violence may be children or adults. I just hope that you will cover all the serious cases. F. Some special groups. We will have to give them more attention. Yes, I agree, but I hope we will act sex workers. Because there is a recent case involving 2 sex workers who are killed. And for F, I would like to add to that the procedure and guidelines when it comes to the police dealing with domestic violence and sexual violence. They now call it domestic incidents, but I know that there is a 3-tier mechanism in place. Ms. Chen, I agree with what Mr. Zhang said in his letter, but I would like to add something. But I'm not going to read them all out because I only have 10 minutes. I'd like to add a few points first. When it comes to community mental health and rehabilitation issues, I have 6 points. I would put it on paper to give to the Secretariat. I would like to just add my views to it. Dr. Zhang, I would like to follow up on what Ms. Wang said. Yes, she's very reasonable. We have to make it clear that it should include sex workers, but they are actually covered in some other areas. When it comes to D, review on child death and serious cases, but that is a mechanism, so you can't change it to say leading to death. And I think it should be added elsewhere. Review on child fatality and serious cases. There is already a mechanism that is working every year. I put that there because I want to have a discussion on the mechanism. Ms. Chen will supply more information to the clerk. 6 points. I have it here, but I don't want to rush, because there won't be time for discussion. Or perhaps you will give it to the clerk and for a paper to be prepared, and then it will be submitted to the panel for discussion before conclusion is reached. What about time? When do you think the subcommittee will be set up? If I remember right, in early December there is one chance. We'll have to work on the terms of reference and then invite members to sign up. So it's ready to be set up, yes. There is no need for it to queue. If there are no other business, then meeting adjourned. Thank you.